Especially robotic surgery is transforming colorectal surgery significantly. So the way how we do pelvic surgery has changed significantly during the last decade. As we know, a good cancer operation certainly requires good specimen development or the removal of a good rectal specimen from the body, and this helps with the reduction of the local recurrence. With the high precision, good visualization with the 3D image quality, certainly the quality of the surgery we perform deep in the pelvis is also improved. We tried different techniques, for example, like transanal TME or laparoscopy. Certainly, we were able to accomplish similar outcomes, but certainly robotic surgery has proven itself that is certainly in a great degree superior. So that's why I think robotic surgery is continue to expand, and we know that globally the level of amount of robotic surgeries that are performed are gradually increasing. Certainly, robotic colorectal surgery deep in the pelvis provides certain advantages. For example, more dexterity with articulating arms. We can see angles that we are not normally able to see with strict instruments like or strict camera. Certainly, deep in the pelvis, once we go deep inside, we can, for example, look from bottom up and see the angles that we were normally not able to see. Not only the visualization, but also to reach to that areas with an articulating arm enables us to get the rectum removed even in difficult pelvic dissections. That's one aspect. Another aspect is even lateral pelvic lymph node dissection, for example. We can do these as well. Like anything else, for any procedure surgeons perform, there's a learning curve. So it takes several cases, and for different procedures, that number may be different. For robotic surgery, the number of cases that deep inside of the pelvis, maybe 20 to 40 cases or so. But they need to keep doing these procedures and learn from their mentors, from their professors, how to really perform a good operation. The precision and really recognizing the tissues are important with the robotic surgery. What skills do they have to develop is to be able to control robot, and the tool successfully is what they need to gain. At the same time, of course, they need to understand the anatomy and the tissues. And with the robotic technology, especially earlier platforms, we don't have much tactile feedback. So the other skill to your question is probably they need to develop the visual feedback, what we call. So you can really see and how the tension on the tissues are changing visually. So they need to develop that visual feedback in terms of skill development. I think the main takeaway here is, first of all, collaboration, and also not only among different disciplines. Certainly, I think they are seeing this as well. Radiation oncologists, medical oncologists, radiologists, surgeons, they are all working in a harmony, but also multicultural collaboration as well. There are surgeons from United States, Europe, England, for all over the world. That this connections and collaborations, how that is leading into a globalization of the surgery and professional life. So I think that is one of the main takeaway message. And of course, we are learning art, this profession. We are getting better and better in different aspects of the surgery, and that way we are able to help our patients in a more skilled and knowledgeable way.